Hello everybody, it's Saima Anis, MD MPH. I'm back tonight, 9 months into the pandemic, to explain to you what it means for us with the vaccines being out. A couple of months ago, Pfizer, Moderna and AstraZeneca came on the limelight to announce to us their delivery of certain vaccines. We were duly relieved, although a little bit worried for some of us, to know that these vaccines were developed and approved and sent out as early as within a year's time or less than a year's time. However, as compared to other vaccines that have taken so much longer, such as the flu vaccine in development, the cold vaccine in development, the HIV vaccine in development, how come this happened right away? So I'm going to try and enlighten you to some of the facts as you should understand them prior to consenting to receiving the vaccine. And also, if there are any questions or concerns, you may contact me at the end of this message and I will try and answer them for you. Here's a few things that you must understand. The vaccine is an mRNA virus vaccine. It is administered in 2 doses and it is relatively safe and effective for most of the populations. The only side effects that have been noted have been mild to date, and from the UK you may have heard a news piece about allergic reactions in 2 of the healthcare workers and when they were initially administered last week. You must understand that the vaccines are only administered under the care and supervision of a provider in a doctor's office. If any described allergic reactions occur, they should be managed aggressively. And a history of specific allergies, including food and drugs and nickel and mercury, those kinds of things would have been elicited from the patient prior to administration. So that in fact covers some of the basics of administration. The other thing you must understand is that 2 doses means that the first dose sends on our body on a path to make our own immunity, and the second dose kind of completes that cycle. Going on to what the vaccine is made up of. The constituents of the vaccine are mainly what you've been reading in the news and discussing is the mRNA. The mRNA is a building block within our bodies, within our cells, and it's a novel approach to vaccination because with most other vaccines, such as the flu vaccine, you are administered the an attenuated virus vector into your cells. In this case, it's not an attenuated virus vector, however, it's a building block of the virus that is injected. So that is the mRNA. This mRNA elicits an immune response within your body cells, and it actually calls out the correct kind of immunological response or cells to fight that mRNA. It is more robust as a result, the response in our bodies. It is better suited for our systems to fight it. And in a nutshell, the terminology that is used to describe this is that it is more efficacious. The efficacy of these 2 vaccines right now is considered anywhere between 90 to 95 to 98%, which is pretty high compared to other vaccines. And what does that mean? That means that the 2 or 3 or 4 or 5% of people that may still get contract the disease COVID-19 will potentially have milder symptoms as a result of this vaccine being administered to them. So that's all really good news. We can safely say that we're at a point where we're trying to build on from who is the most needy or deserving of this vaccine at the get-go. And what that means is your frontline workers, your providers, your healthcare practitioners, your emergency medical teams, your nurses, and as far as the patient population goes, people who are not already sick, they're thinking of picking out the elderly. And they've done that successfully in England, and they've done that in the US now. And hopefully, the trickle down effect of this administration will be also observed in a whole bunch of other countries, and especially in developing countries. It has come to my knowledge, and it should be out there from an article in Bloomberg, that most of the developing countries are covered by the Chinese version of the vaccine, and the entire contents and the composition of the vaccine have yet to be determined. However, US, UK, Spain, Germany, Italy are mostly relying on Pfizer and Moderna as vaccination supply chains. An interesting point about the supply chain of this vaccine is, to the rest of the Western world, the timing almost coincides with the supply chain and logistical management. For instance, it's the dead of winter here in the USA, and as we're gearing up towards the rollout, and we've actually started rolling them out. Yesterday, December 15th, was the first supply in some of the major US hospitals. In December 16, 2020, is the timing for beginning the administration of the vaccine. What that means is the cold chain of those very highly freezing temperatures has been easily maintained. And that's all good news. Even with the power outages, if that may be the case, the logistical management is dependent upon dry ice. And the freight and logistical management supply companies, in the US at least, are very well prepared to handle that, because they've been using dry ice forever for transportation of sensitive materials and other products. Suffice it to say that we are in good hands, and we are also entering a phase of precautionary measures, but at the same time, all is not lost. There is hope now at the end of this 9-month pandemic, towards a light shining at the end of the tunnel. So with that, I will leave you with just one other message, which is the next 4 to 8 weeks in the developed world, in the US, the UK, are exceedingly crucial and critical to utilizing your preventive strategies. What that means is, as much as you can, you need to be very, very careful about mingling and socializing. We realize it's the holiday period, and that can get challenging for some, with the sense of this COVID, overall general social isolation fatigue setting in with the COVID pandemic. My advice would be to follow social distancing and physical distancing and limit mingling, and if at all there is any need to do so at a distance of at least 6 to 8 feet, with masks properly worn at all times. Limit your activities to activities of daily living, and only very necessary errands if need be. And the hope is, as public health agencies and CDC have also advised us, if we go along that route, then the light that shines at the end of the tunnel isn't too far away. If everything goes well, April 2021 may bring us some relief. And if we look at the worst case scenario, we may be still wearing masks in the fall of 2021. But I think that would be a cautiously optimistic view. So let's stick to the more optimistic view, which is we can fight this together and keep our morale high and be adequately and sufficiently satisfied with the fact that the world is now witnessing the rollout of a great big event in this pandemic, which is the vaccine. Thank you very much and have a great day.